Welcome back to the deep dive. This is where we tackle a complex topic, dig through the research, and give you the key takeaways you need fast. Today, we're zeroing in on something called mastocytosis. It's a rare disorder, but one that causes a lot of confusion. And just so you know, the sources we're pulling from today, they come from the amazing team at Mind Expansion Daily. Seriously, you should visit their site, mindexpansiondaily.com, for fantastic information like this. While you're thinking about it, maybe hit that like and subscribe button. Helps us build this community. And, if you find this useful, we've got a link in the description where you can buy us a coffee. Every bit helps support the work we do here. Okay, so our mission today, to really understand mastocytosis. It affects maybe 1 in 10,000 people worldwide, which sounds rare, but that's still about 33,000 Americans. The big challenge, it's like a diagnostic chameleon, super hard to pin down sometimes. We definitely want to hear what you think about our summary later. Drop a comment, agree, disagree, let us know. Oh, and tell us where you're listening from. We're trying to see how far this reaches globally.
Right. And that chameleon aspect, the high misdiagnosis rate, that's
Hmm.
exactly why we need to talk about this now. So, mastocytosis. Fundamentally, it's about having too many mast cells. Think of it like your body has this immune factory that's gone into overdrive. Mast cells are normally good, right? They handle allergic reactions, fight off infections. But here, there are just too many, and they're constantly releasing chemicals like histamine. And those chemicals just wreak havoc throughout the body.
Havoc is a good word because the symptoms, they seem so, common. That's why it gets missed half the time, right? That 50% misdiagnosis rate is just staggering. Is there something specific about how doctors usually think that makes it easy to kind of dismiss these things like fatigue?
It's totally the
Like,
overlap.
yeah.
Yeah. A patient comes in tired all the time, stomach's always upset, maybe bad skin rashes. The doctor's first thought is, okay, maybe it's IBS, maybe chronic fatigue syndrome, maybe just bad eczema or allergies. They reach for the common explanation first.
Exactly. And we saw this anecdote online, really took off a post on X, I think, from 2024. It got like 8,000 likes. It was someone saying they suffered for years, thought it was just terrible IBS, constant stomach pain. Turned out mastocytosis.
Hmm. That story sounds very familiar, unfortunately.
And then there's this other layer. It hits women more often, right?
Yeah.
About 60% of cases. And they can have these flares linked to hormones, making the symptoms come and go, which must make it even harder to diagnose.
Absolutely. It adds another variable that can confuse the picture.
Yeah.
But getting the diagnosis right early on, it makes a huge difference. There's solid data on this. Like Health Affairs reported that as of 2024, getting an early diagnosis cut hospital stays by about 15%. That saves money too, an estimated $150 million.
Right.
So finding the right answer sooner is better for the patient and the system.
Okay, so it saves money, but what about the personal cost of not getting diagnosed quickly?
That's where it gets really serious. For people with the systemic kind, where it affects organs, about 20%, 1 in 5, face anaphylaxis, that's a severe, potentially life-threatening allergic reaction. There's about a 5% mortality risk with those episodes.
Wow.
Yeah. And if you're in a high-risk group, maybe you have that systemic form, or you're often exposed to known triggers. Your overall outcome can be about 25% worse if diagnosis is delayed. So misdiagnosis isn't just frustrating, it can be genuinely dangerous.
Okay, so let's break down what these rogue mast cells are actually doing. The sources highlighted 7 main effects. Let's think of it as allergies just gone completely wild. The number one thing affecting, 70% of people is itchy skin. And we're not talking just a little dry patch. This is like persistent hives, rashes, relentless itching, like a constant allergic reaction on your skin.
Exactly. That's very common, especially in the cutaneous skin-focused form.
Then number 2, hitting 60%, is gastrointestinal issues. So stomach pain, feeling nauseous, diarrhea, all chronic.
Very disruptive to daily life.
And then there's fatigue. About half of patients, 50%, feel this deep chronic exhaustion that sleep just doesn't fix.
Right. A bone-deep tiredness.
And the fourth one is flushing sudden redness, feeling hot in the face or neck, affects about 40%. Easily mistaken for other things, I imagine.
Definitely. Hot flashes, maybe even just blushing. Easy to overlook. Now, those symptoms often point towards the cutaneous form, the one mostly in the skin. But when it goes deeper, when it's systemic, meaning those mast cells are in places like bone marrow, the liver, the gut, the signs can be different and often, frankly, more alarming.
Okay, so what are those more systemic signs?
Well, about 30% of systemic patients get bone pain. a deep, aching kind of pain.
Why bone pain?
Because the mast cells can actually gather in the bone marrow itself, causes inflammation and pain right in the bones.
Ouch. Okay. What else?
Then you have those severe allergic reactions. We mentioned anaphylaxis. That affects about 20% of systemic cases. That's the swelling, the trouble breathing,
Yeah.
the really scary stuff.
Yep.
And finally, the seventh key effect is low blood pressure. About 25% experience this. It can cause dizziness, fainting spells, and it's often linked to those chemical releases, the vasodilation, sometimes happening right before or during an anaphylactic event.
So those are the big 7.
Yes, but it's even broader. The sources also flagged a couple of missed symptoms that still affect quite a few people, like chronic headaches in about 20%, and heart palpitations, like your heart is racing or skipping beats, that happens in about 15%. It really shows how this thing can pop up almost anywhere in the body.
It's truly systemic then. So what's actually driving it? Why does this immune factory go haywire?
It seems to be a mix of genetics and, well, triggers.
Genetics first.
Yeah, the big one is a mutation in a gene called KT.
Yeah.
It's found in something like 80% of cases. It seems to be the underlying driver for many people.
Okay, 80% is huge, but what about triggers? You said they matter too.
They do. For about 30% of patients, even if they have the mutation, their flare-ups are set off by specific things. Could be certain foods, could be stress, could even be medications like aspirin or certain painkillers. It's very individual.
So managing it involves figuring out your personal triggers.
Absolutely. Avoiding those triggers is a huge part of managing the condition. And knowing the type of mastocytosis is also critical for treatment.
Right. You mentioned types. What are they?
The most common, about 60% of cases, is cutaneous mastocytosis. That's pretty much limited to the skin, usually less severe overall.
Okay.
Then you've got systemic mastocytosis. That's about 30%. Here, the mast cells have infiltrated internal organs, bone marrow, liver, spleen, gut. This needs closer monitoring.
And the last one.
Is very rare, thankfully less than 1%. It's called mast cell leukemia. It's an aggressive, cancerous form.
Got it. So someone's been suffering. They finally get to a doctor who suspects this. How do they actually confirm it? What's the diagnostic path?
It's usually a few steps, trying to find where those extra mast cells are. If skin symptoms are the main thing, a skin biopsy is often the first step. It can confirm about 70% of those cutaneous cases, just taking a small sample of the affected skin.
Makes sense. What if they suspect it's systemic, like with the bone pain?
Then the next step might be a bone marrow biopsy. It sounds intense, but it's very effective. Detects about 80% of systemic cases by looking directly at the marrow.
Okay. Are there blood tests too?
Yes, definitely. Blood tests are crucial. They look for elevated levels of tryptase.
Tryptase, that's one of the chemicals the mast cells release.
Exactly. High tryptase levels are found in about 60% of patients and can be a really important early clue that something's up with the mast cells.
So once you finally get that diagnosis, what's the outlook? Is there hope?
Oh, absolutely. Getting the diagnosis is key because treatments can make a big difference. It's mostly about controlling those chemical mediators. Simple antihistamines. They help manage symptoms for about 60% of patients.
That's pretty good for something relatively simple.
It is. And then there are mast cell stabilizers, like a drug called cromolyn. They help stabilize the mast cells themselves, preventing them from releasing so many chemicals. That helps about half of patients.
Okay.
And as we said, avoiding triggers. That alone can reduce flares significantly in about 70% of people who identify and avoid their triggers. It really improves quality of life.
That ability to get control back must be huge, especially after potentially years of not knowing what's wrong. We saw that story about Sarah, the 42-year-old teacher. It really drove this home. Years of being told her itching and stomach issues were just stress, maybe bad allergies, misdiagnosed constantly. Just imagine how exhausting that must be.
Feeling dismissed or unheard is so common with rare diseases.
Right. But then, in 2023, she finally got the diagnosis, systemic mastocytosis. And starting on antihistamines, really focusing on avoiding her triggers, it made a massive difference. Her story just perfectly highlights why getting that diagnosis, even if it's for a rare condition, is so critical. It's the starting line for getting better.
Exactly. So if we boil this all down, the main message for you listening is awareness. Knowing that these persistent kind of weird symptoms, the itching, the GI problems, the fatigue, could be something more than just allergies or stress.
Yeah.
That's vital for the 33,000 or so Americans dealing with this.
And it has real-world impact.
It does. We know 20% of systemic cases face anaphylaxis. But awareness campaigns are working. They've already started to chip away at that misdiagnosis rate, maybe by 10% in 2024. And that saved an estimated $50 million in healthcare costs. So awareness helps patients and the system.
That momentum is definitely something we need to keep building. Okay, so back to our challenge from the beginning. We shared a lot today about mastocytosis. If you agree with our take or maybe disagree, let us know in the comments. We really want to hear your thoughts. And please tell us where you're tuning in from. We love seeing our global reach grow. All right, and one last thing to leave you with, something to chew on. We heard that treatments can control symptoms pretty well, like for 60% of patients, often within months of diagnosis. So given that, what single policy change do you think could most effectively slash that stubborn 50% misdiagnosis rate for rare diseases like mastocytosis? Is it more training for GPs, mandatory screening checklists, something else entirely? Let us know what you think. We'll be back soon with another deep dive.